Our nation is honoring the legacy of a leader. Colin Powell, the former Secretary of State and chairman of the Joint Chiefs, died of complications from COVID-19 this morning. Powell was fully vaccinated but battled underlying conditions. When President Bush appointed Powell as Secretary of State, he became the highest-ranking African-American official in United States history. Colin Powell was 84. 3 years ago, Colin Powell was recognized with this mural in Philadelphia. It's on the side of Olney Charter High School. The mural honors Powell for his role in an organization that brings leaders from all around the world to the U.S. for workshops on global issues. Colin Powell, who died from complications related to COVID-19, highlights the risks millions of Americans are still facing, even for people who are vaccinated. Health reporter Stephanie Stahl joins us now to explain why. Stephanie?
Well, you know, Yuki, the vaccines have saved millions of lives, but COVID-19 that is still circulating can still be deadly for people like Colin Powell, who are elderly and immunocompromised. 84-year-old Colin Powell had Parkinson's disease, a history of prostate cancer, and also multiple myeloma. That's a blood cancer that affects bone marrow and white blood cells, impairing the body's ability to fight infection. A statement from Powell's family says he died of complications of COVID-19 despite being fully vaccinated.
While I certainly understand that the death of a notable person, a hero like General Powell from a breakthrough infection will make headlines and may make you question your vaccination, the reality is that the vaccinations are highly protective.
Breakthrough COVID infections that happen after someone is fully vaccinated are most dangerous for patients with underlying medical conditions. More than 189 million people in the U.S. have been fully vaccinated against COVID-19. To date, the CDC has received reports of nearly 32,000 patients with breakthrough infections who were hospitalized or died.
The vaccines are not perfect, but they do provide an extraordinarily strong measure of protection. And then if we add on continuing wearing the masks, social distancing, we'll be protected even further.
General Powell was reportedly vaccinated early and got sick before he was able to get a scheduled booster shot.
When we try and convince young people who feel that they are low risk from the virus itself why they need to be vaccinated, it's to protect our treasures, our people like General Powell, our grandparents.
And Colin Powell's wife also had a breakthrough case, but she was successfully treated with monoclonal antibodies. It is not known how they were infected or what treatments General Powell received. Yuki?
All right, Stephanie, thank you for that. And we invite you to stay with Eyewitness News and CBSPhilly.com for continuing coverage of the passing and legacy of General Colin Powell.